welcome back, everybody. Welcome back to the pre-admission game. It's so wonderful to have all of you guys listening in the lead up to interviews. We're just about to wrap up interview season, aren't we, Mitch?
Indeed we are, and to timestamp this episode, we are still in lockdown. Melbourne. We've had the final sort of roadmap, I suppose you could say, announced. So we know when we're getting out of this.
We know when we're finally getting back into the studio.
Yeah.
The roadmap back into the actual studio, yeah.
So we can hopefully give you, lovely ladies and gentlemen, more brilliant content over the summer.
And guests.
And guests.
When we can get numbers in a room, right?
I can only dream.
Yeah.
Anyway, so today, everyone, we are going to be talking about motivation, and that's motivation towards specifically medicine, this being a medical, pre-medical podcast. And we're going to touch on things like, why do you want to study medicine? What attracts you specifically to medicine and not some other allied health profession? How well you think you're going to manage the stresses of medicine as both a profession and the medical course? And what you think medicine will do for you and how medicine is going to change your life.
Yeah, essentially this question is basically a guaranteed. It's a staple of so many MMIs, certainly the Uni Melbourne MMI that's coming up in a week and a half or so.
I mean, certainly I was asked a similar question. We're not supposed to talk about what specific things come up in universities.
Oh God, can I be sued now? Am I liable?
But essentially, it goes without saying that literally every university, whether you're in Australia, the UK, it doesn't matter. Everyone is going to be trying to assess your motivation to study medicine. And so it's only fitting that we do an episode on this, as we come into the Australian medical interview
the home
season.
Stretch. Yeah.
Exactly, indeed.
Yeah, this question, I think because it's asked so often, it's one of the most daunting questions. I think, for two reasons. First of all, like I said, it's asked often, so you almost feel like there's a real struggle to sound original, which we're going to touch on in a second. But also, I think one of the other challenges is sometimes the things that we want from medicine are perhaps not the things that are necessarily always palatable in an interview setting. And I don't mean, absurd things like I want to be a doctor because I want to drive a Lamborghini. I don't think that's palatable, really.
It's not palatable.
And
it's also very unlikely.
Incredibly unlikely that you will earn that sort of money. But far more importantly, because sometimes we have these very niche, specific interests. Sometimes we have a very emotional connection with our desire to do med, and that by no means is invalid. Right? It's very valid to want to, become an oncologist because you have a history of, difficulty with cancer in your family. But it's also important to remember that this university interview is a sort of professional interview in the sense that they want a sophisticated, logical argument for why you want to become a doctor, perhaps more so than an emotional one. Not to say that in the real world one matters more, one matters less. This is purely a pre-admission game, I guess, and you have to win, right? That's what we keep saying.
We do want you to win if possible.
Yeah, exactly.
And I suppose so. You're with two very different people in many ways, because I'm more of the sort of wear the heart on the sleeve kind of guy, very emotional in my approach to these motivation questions, and Aaron tends to cut through these things with clinical precision.
Very analytical.
So you are in good hands. I think you'll have a nice balanced approach to this station, hopefully by the end.
It's a very nice way of putting it, Mitch.
So I suppose, Aaron, so if we were to talk about, a station broadly, something we're going to hear in various shapes and forms, essentially the question, why medicine?
And it's interesting, sometimes, at least in the past, because when they ran the interviews for like dentistry, physio, and med all together. They often phrase the question sort of to save time and money on their end as why do you want to get involved in health science? And that's not something to throw you off, right? Obviously, you don't want to get involved in health science. You want to get involved in physio, dent, or med, whatever it is that you want to do. So make sure that doesn't necessarily change your answer.
So if you see health science in the question or, a healthcare profession, assume they are asking you about medicine and don't sort of get off put by that and think, oh, well, actually, I'm applying to medicine. I don't know if you guys missed the memo here or anything like that.
They haven't missed the memo. They're just making their interview stations standardized and cheaper to run.
That's right. Yeah, the universities like to save money. I don't know if you've found that on your undergraduate degree so far, probably. But yeah. So, okay, Aaron. So we've got this, you've been asked a station about why medicine. How would you first go about approaching something like this?
Okay, so the first thing to remember is that there is no need to reinvent the wheel. At this point, it's impossible to reinvent the wheel. There are only a limited number of reasons why you would want to practice med. Potentially, probably you find the science to be incredibly fascinating. It's sort of a completely different worldview, a completely different lens. The job is fantastic. You get to work in a team. You get to take on real significant responsibilities, which is wonderful. It's a wonderful way of contributing to the community. You get to get involved in research. And of course, it's a very sociable profession. It's not your biomedical science in a lab or you're shut away running experiments. You're constantly talking to your team members, your patients. So all of those things are things that are probably the major reasons why most people want to practice med.
In addition to sort of being able to spend lots of time with people, I suppose you
Yes,
have
yes,
touched on that,
absolutely.
but being able to see someone as they're growing up, care for their parents and their grandparents, and then also care for people as they're sort of starting to have their own families and things like that as well.
Your emotional component is really shining through here, Mitch.
What I'm trying to say as a balance to Aaron is that there are many other, good things about medicine in addition to just being interested in the sciences. But you're 100% right. I agree that, when you're trying to think of why you want to do medicine and approach this station, don't feel like you have to do, say something that's never been said before. Chances are, I think, and you may have come across this in your life so far, but also you will definitely, as you enter medicine, you'll realize that people are different, but they're also quite similar. And your motivation to want to enter medicine will be, of a select number of things, but it's not an infinite number of reasons why someone would want to come into medicine.
Absolutely, and I think that leads us to the point where we have to say that you have to strike the balance between sounding cliche and sounding reasonable. And if I give you two absurd statements on either end of that spectrum, sounding cliche is something like, I want to save the world, I want to help people. I think that's a little bit too diluted. And the other side of that spectrum, being hyper-specific, hyper-reasonable, you can say something like, I'm interested in diseases related to cytochrome, like CYP450. That's also equally absurd because that's so narrow a perspective on medicine, probably indicates to the assessor that you don't really know.
Unless perhaps you've done a PhD in that already.
Right. Okay. Maybe there are some exceptions to this rule, but as a for a general, certainly, I'm thinking from my perspective. When I was an undergrad, if I'd said sort of anything on the extremes of that spectrum, probably wouldn't have been too enticing and impressive to my interviewer.
Because it's not a station about demonstrating your overt intelligence to the examiner. It's
they have your resume.
That's right. They know what your GAMSAT score is. They know roughly what your portfolio is. If that is something that is relevant for your university, and they ultimately and they have your GPA, of course. So what they want to know now is, why do you want to be here? Do you want to be in this course more than the next 3 or so other people that have applied for that particular spot you're going for? So I suppose, why med? Well, we've touched on don't sound too cliche, don't sound overly specific, I suppose, either, or too, what was the word that you used? You said
specific, detailed, technical.
Technical.
Oh, there we go.
And I suppose, so how do you go about striking a balance here? Just try to think of experiences that you've had where you've been involved with the medical profession up until now. You might have just experienced medicine as a patient. You might have just gone and seen your GP and been really inspired by them, and that's perfectly valid. There's nothing that says that, being inspired by the general practitioners, or knowing a particular specialist that one of your parents has gone to see, or a family friend or something like that you've sort of come to know over the years. And there's nothing wrong with drawing upon that and using that in your motivation station. You don't need to say, well, I have this idea that I want to be this particular surgeon, a cardiothoracic surgeon. I want to cut people's hearts.
Sounds kind of silly, thinking about the 20 years of training that you have to do after you graduate from medical school, you knowing that you want to do that 24 years in advance. There's so many things that are going to happen in your life in those next 24 years. It sounds like a bit of a strange.
Exactly. So, I mean, what is going to sound genuine is you approaching the station in a way that is tangible and relevant to your level of experience. You don't have to be someone who says, I want to be a subspecialist in this because of some article I read which, really got me inspired. More relevant would be just, talking about certain people that you've come into contact with, certain elements of interactions that you've had with either doctors or other people, for that matter, who have just pushed you in the direction of medicine. And that is something that's super valid, quite genuine, and I think would see you in good stead for the motivation station.
But having said that, what we also have to remember is that this is an opportunity for you to market yourself, right? So to say that you've been to your GP and your GP inspired you full stop without elaborating on that is really not the way to go.
No.
So for example, I remember, this isn't something that I talked about necessarily directly in my interview, but it's certainly something that motivated me to do medicine. As I remember, I had to... Can I disclose elements of my medical record for everybody to hear? Well, I'll try and de-identify myself. I was in a situation where I had to have a minor procedure, and I remember how the specialist interacted with the team, how he communicated with me, and what that showed me is that not only was he sort of a master of the biomedical science and technical expertise was outstanding, but it's also the respect that he treated me with and the way he empowered me to take control of my health. And I know that sounds cheesy, but the reality was I was unwell one day and I was able to get well physically and also get well psychologically as a result of the things that he did and said. And that motivated my career choice, right? So when we talk about your experiences, we have to be as concrete as we can without being absurdly specific. So say, what is it that this person did and how did you perceive it and what your logic chain was in your mind that motivated you to do medicine.
Yeah.
Not I saw my GP drive an expensive car and I like that. Not I saw the surgeon acting like a boss in this context and I was like, wow, I want that position of authority. Right? We want to have a little bit of a nuance that underpins the sort of the emotional and logical approach that you take to making a career decision.
Fantastic. And I think you've touched on some great things there where you talked about sort of things maybe not to touch on. I suppose people in medicine are there for many reasons. And I suppose what they're really trying to work out in this station is, are you here for the right reasons? I feel like we're talking about The Bachelor here.
So, who gets the rose?
Yeah, that's right.
Who gets the stethoscope? Maybe they should turn that into a reality show.
Yeah. And I suppose with that, we need to think, well, what is a valid reason for doing medicine and what is an invalid reason? We've talked about some great valid reasons for why to do medicine. And I think that while I don't want to sort of poo-poo certain things, because if they're real for people and they have a good justification for it, then sure, say whatever you like.
But it's the marketing, right? It's how you're perceived as much as it is what you believe.
That's right. But remember, these medical schools are trying to filter out people that are sort of egomaniacal, people that are really power hungry and
financially oriented.
That's right. People that are a bit sociopathic.
Yeah.
And
hero complexes, people who want to save the world rather than be patient-centered in their care.
That's right. And people who are going to, what am I thinking here? People that are sort of scoring high on neuroticism scales, things that people that may fall a bit, how do I say this? they may not be able to cope with the demands of the course and later on the track with the demands of the profession.
To a degree of emotional resilience, I suppose.
That's right. So I suppose while we've given you some general ideas of things that you should say, I think just try and be aware without, saying certain things are bad. Just be aware when you're talking about your motivation. Am I just saying that I'm, super smart and I'm super, I want to do something where I'm in control? Is that really selling yourself in the right way? Because personally, if I was on the panel, which I'm not, and it would be a conflict of me to be doing this if I were, but if I, just as another person, a member of the community, if I was thinking about which doctors I would like to see, I wouldn't want to see egomaniacal, power-hungry, finance-driven doctors who are, not, going to be fully considerate of my needs as a patient, and are going to sort of be maybe high on the neuroticism scale. So
you want somebody who's empathetic, who is able to communicate with you and understand you to a certain degree. You want a human being.
Absolutely.
Right? Not something detached from
you. And that's
yeah.
why it's perfectly acceptable to have real human, motivations that don't need to be, these things that go over and above. I mean, yes, we want you to be impressive, but there is a limit to how impressive, potentially you can be in our sort of humble position as pre-medical people.
Yeah. Remember, you're talking to medical students, members of the community, and doctors, right? So people who are in many ways senior to you, life experience and qualifications. So let that contextualize the things that you say.
And I think that many
Yeah.
doctors in particular are very good at understanding people, so they can often see through a lot of.
That's their job, right?
Yeah,
To see through people.
they see through the BS, and they can really drill down on what you're trying to say and what your motivations are. So try and be genuine if you can.
Okay, so now that we've given you sort of the broad strokes of why med, why healthcare science, this question often has quite a few different follow-ups, which are just as tricky, I think, as the original STEM. And one of the types of follow-ups that you can get to why med is, what are the stresses, what are the challenges that you expect to face in med, and how have you prepared for them? Right? So I think it's interesting here. Well, I think Mitch and I, we might talk about what we perceive the challenges to be, and then we might add in a couple of comments about what we found the challenges to be in real life to sort of color your discussion of this, because I think with this question, when you do your research, it really shows. If you answer this question, you think, I think one of the stresses of medicine is going to be, God, I don't know, carrying around my stethoscope all day, or like something really arbitrary.
The weight on my neck.
The weight on my yeah, exactly. God, it's going to be really, really hard. Holding people's hands in their last moments of life. Like if you talk about something that is really, really detached from actual medical school, then it will just show that you haven't done your research. So it's important to, again, show genuine concerns, reflect on genuine potential stresses, but also demonstrate that you're sort of aware of what these stresses are.
And if you can,
life.
I mean, it's really good to talk to
Absolutely.
other doctors, other medical students that you may know.
Maybe even listen to a medical students podcast.
Maybe.
Yeah.
talk to your buddies, Aaron and Mitch.
Aaron and Mitch,
Yeah. So I suppose what are we trying to say then? Well, we need to think, what are the stresses? So the way I would split this up is, what is stressful or what is going to be difficult about medical school?
And what was difficult as well, yeah.
And why is it difficult? And then later, what is difficult about and why is it difficult to be a doctor later on down the track?
Absolutely.
So should we start with medical school? Aaron, what have you found to be some of the challenges?
I think the most obvious big step from biomedical science to med, and I can't speak for other degrees, but certainly from science to med, is that science is very theory-oriented, right? And you have the format of the teaching is sort of, this is how the world works, this is why the world works this way. With med, yes, there is an element of the biomedical science that underpins it, but you've got to remember that it's sort of like an apprenticeship, right? They're training you to be an intern that can competently treat patients. And as a junior doctor, often you're the administrator of treatment rather than the decision maker. So you need to know how to manage a lot of the situations in the absence of perhaps knowing the full details of the biomedical science. Like you need to know that if somebody feels unwell in a particular context, you do these 3 tests, you give them these antibiotics, and then you wait for your boss to help you sort the situation out, right? And what that means is that there's a lot of stuff that you have to remember. The volume of content that you have to learn isn't just difficult biomedically, but there's just a lot of rote memorization that you need to take on board with med to make you a safe doctor in the beginning stages of your career. So that volume is quite enormous, and it's very, very difficult to absorb and rationalize and organize that volume in your head so that you can actually use it on the wards.
And I think that the step is so great that really you need to be fully immersed in your medical education for a few years. I mean, coming to the end now, we're in 4th year. We're sort of just coming to our towards our internship now, and I think we've only just started to sort of take a step back and think, I think we've got to try and regain some sense of self here, and take time for ourselves to really, before we get stuck into our internships. And I suppose one of the things that is challenging about being a medical student is the fact that you have to really manage your competing demands. I mean, medical school will take the bulk of your life up for a period of time. And you do have to take steps to try and balance that where possible to minimize burnout and other things. You really do need to be prepared, and I suppose it could be something that you're aware of and you make them aware of in your answer, that you're aware of the commitments of acquiring this volume of knowledge that you're going to have to go about throughout your medical education.
Absolutely. And the thing with this volume as well is that on the one hand, yes, you're sort of managing your stress and your burnout and making sure that sort of from a mental perspective, you're keeping on, and you're healthy. But on the other hand, sort of from the learning side of things, you'll find that you're relearning things lots and lots of times, because the volume is so great, you keep forgetting stuff, and some stuff will be left by the wayside, and you'll have to manage your time very carefully. You'll have to keep yourself accountable. So in terms of managing the stress, yes, it is about de-stressing. That's rule number one. Rule number two is creating an effective study strategy. How are you going to stratify this content? How are you going to organize it? What are you going to prioritize, deprioritize? Because the old method of learn absolutely everything, smash out your exams is not viable. It's impossible.
You can't learn all of the medical content.
No,
it's not possible.
Yeah.
So I suppose for people who are coming from that background and maybe a science sort of biomedicals type background where they're used to learning absolutely everything in the content base for the syllabus, that's just not possible. And I think it's eaten up many smart people over the years, and they really struggle. So you do have to be willing to sort of know where your limits are and what you can and can't forego learning.
Absolutely. Now that we've talked about the content, the rote learning, well, I shouldn't call it rote learning. Some of it is not rote, but the volume learned.
Yeah.
Right, Mitch, do you want to talk about the challenge in moving from the book study into the actual hospital? Is that something you found difficult?
Yes. No, that is a very good point. So I suppose when you're doing your preclinical education, which we've touched on in previous episodes, but that pretty much just means you're in the lecture halls and you're in shoots. You're not on the wards per se. When you go into clinical education, which is those sort of latter 2 or 3 years, you'll be on the wards pretty much 24/7. Well, not 24/7, but for your
a lot of the time,
sort of for sort of 5 or 6 hours a day.
But if you're a keen neurosurgeon to be, perhaps maybe that's what it takes.
For your professional hours of your education, you will be in the hospital, and that creates its own challenges. Yes, like you are trying to acquire all of this knowledge still, but you're also balancing sort of professional dynamics, which is something that's not taught and quite difficult in many ways, because you have to balance your position as a medical student where you're essentially a guest on the medical team. You're not really adding value. In fact, you're taking time away from the junior doctors and the registrars and the consultants. So if anything, you're a bit of a handbrake on the whole kind of hospital team.
Don't be so mean, Mitch.
No, we're important. No.
Yeah, absolutely.
I mean, if you're like Aaron and you're very valuable, then you're adding value. But
Mitch has just never worked on a team with me. He doesn't know.
But the point is that you do have to navigate this professional situation, and that can be easy for many people who have had terms of employment, people who come from allied health or other healthcare backgrounds, who understand the hospital system well. But for those who don't, it is a big learning curve and something that takes time to get around. In addition to that, you've got this patient factor, this patient that you've been doing all this education for, but you've never actually seen.
I remember whenever I had to do procedures early on, sort of in second year, whenever I had to actually go interview a patient and report back to a doctor, and it was something that was reasonably critical is the wrong word, important for the treatment of the patient. Somebody else could have done it, but I was asked to do it. Put the needle in, get a medical history. I remember that you have to sort of fake it till you make it. You tense up inside, and you're like, okay, I know how to do this. I know the steps. You walk in there, and you sort of it's quite stressful. I think the first time you do it, even if you're well prepared.
Absolutely, yeah. You occasionally get the patient who says, "Have you done this before?" And you have to go.
Navigating those hot waters. It's like, yeah. Have you done it before if you've practiced on the mannequin? What are the sort of legal implications of saying yes?
I just have to own it and say, no, you
Absolutely.
are my first live person.
Yeah. But don't worry, I'm very well prepared.
Indeed. So as we've sort of come to, there are many challenges in your medical schooling education. And I think work-life balance is one of the most challenging. And I mean, if you're someone with other responsibilities, if you've got children, if you have another important job that you need to finance yourself through medical school, these things are really going to, be stretched. And I suppose if you are one of those people, it's good to be aware of this sort of thing and to, strategize and be able to tell the interviewers in the interview, how you intend to manage these things that will be stressed.
So one of the other curveballs that they might throw at you is they might ask you, why do you want to study med? Why not an allied health specialty? Why not, if you want to help people, why not speech therapy or nursing or become a radiographer? Any of these things which are really critical to running a hospital. I mean, there's this, I guess, joke anecdote that sometimes said around the hospital, if a doctor doesn't show up one day, the hospital will keep on running. But if a cook or a nursing staff member or a physiotherapist doesn't show up, the patients will really feel the impact. So if you want to help people, why not any of these? Mitch, what are your thoughts on this?
Thank you for handing that over to me.
I'm not answering that. That's too hard. Yeah.
So I suppose this is a tough question,
Yep.
and I think that most things that you say will in some way be something that you need to argue, because I think for many reasons, if you wanted to help people or you wanted to get something academic out of medicine, I can assure you that there is some element of allied health that could definitely lend itself towards whatever you're saying. So I mean, it's not you can't exactly kill this question, but you can perform well in it, and you can not red flag yourself by saying something inappropriate or sounding as though you don't appreciate and respect the other essential, emphasis on the essential, work that people from allied health and nursing professions, bring to the healthcare system.
Absolutely. I think we've moved in med to this perspective that, if you have a lung infection, for example, as you're an 80-year-old lady, gentleman, you have a lung infection, giving you antibiotics is only half the story. Like, if the doctor gives you antibiotics, by the way, the doctor prescribes the antibiotics, the nursing staff gives you the antibiotics, and they check your dosages and see how you're responding. After that, there's so many other things. You're decompensated from lying in bed, you might feel weak, your diet might be off. All of these things which actually make a real tangible impact on your life, which are looked after by the allied health specialties. The question isn't how to effectively get this patient, from sick to not sick. The question is, how do we get this patient from sick back to their normal life? And the entire multidisciplinary team is critical to making that actually happen.
Absolutely. And I think, Aaron's touched on a really good point there. Don't undervalue the multidisciplinary team, which is, all of the other allied health professions. So you really can't do that. Having said that though, how do you approach a situation like this? Well, I suppose you have to stick to your guns. Like, why do you want to do medicine? I think you wanted to do medicine because it's something that has no limit effectively for the amount of education that you can have and the sort of the ongoing professional development.
Specialization, right? That's one of the big differences. If you wanted to become a surgeon specialist, if you want to become, specifically interested in a very key, very, very nuanced technical procedure, that's the domain of clinicians, or I guess
because
medical.
The reality is that, once if you're a brilliant occupational therapist or a brilliant nurse or whatever, as you go through your career, you'll become, a nurse. Say, if you're a nurse, you will become a brilliant, competent nurse. Then you'll become an assistant nurse unit manager, then a nurse unit manager. And then, from there, if you want to do any further clinical work, you have to retrain into a nurse practitioner role. Or, and there are only limited specialties where that can occur, or you go into admin effectively and go into managerial roles. And that's why, you see so many brilliant nurses that are in managerial roles and in committees and other things like that. But ultimately, there is a ceiling, I suppose you could say, to the level of expertise that you can get within a nursing, profession per se. So medicine in many ways, because it's so, the ceiling is so high, it means that there's always ongoing development.
Continuous learning, absolutely. So there's continuous learning everywhere in healthcare, but especially in I think in med, it's more mandatory, perhaps, given the long years of training post-graduation and specialization. And there's a lot of, it's very biomedical, the biomedical field, as it is related to med, is constantly evolving too. So that continuous learning isn't just you specializing; it's also the ongoing stream of biomedical publications, the ongoing your potential ongoing involvement with these publications that really singles out, I think, the medical specialty in a sense.
Yeah, and I suppose you do end up being kind of a coordinator for the care treating team, in regards to the patient, with the patient at the center, and obviously involved in that conversation as well. So, if you're someone who prefers, to be across multiple areas, I mean, in medicine, we have to understand what the allied healthcare teams are doing, in order to solicit their services for, the benefit of different patients. So, if you're someone who's more interested in operating at that level, then that's, something maybe that medicine is more, more akin to. Whereas, if you're an allied health professional, you're almost like the barrister. You have to just, you are told that you should come and see some patient, and then you go and work your magic on that patient and improve their outcomes in the best way that you know how. So they are slightly different. And lastly, I think just something that I have to mention is that, you shouldn't be saying, I want to do medicine and not nursing or some other allied healthcare, profession because you think you're smart, or because
you find it academically challenging, whatever that means.
Yeah, you wouldn't find it challenging enough, or you're a leader and therefore you should be in medicine. It's not that simple, and you would end up angering a lot of people. You may well be examined by a nurse or another allied healthcare professional, and they're not going to take kindly, nor would any doctor for that matter. If you come across as arrogant in a situation like this. So please steer away from talking about this.
I think in the interest of just priming our audience for treating patients in general, you've got to remember that we have this somewhat arrogant perspective, I think, as doctors, that we sort of hold the keys to the kingdom in terms of healthcare and understanding the world. But I think if you talk to doctors 500 years ago, it's comical to look back 500 years ago and see doctors having a similar attitude. We hold the keys to the kingdom. We know everything about everything. It's really not the case. We're, very, very insignificant and tiny in our understanding of biomedical science. We just happen to be recording this in 2021. In 100 years, the situation will be different, and our perspectives now will seem old-fashioned, irrelevant, under-researched, right? I guess the elaborate point, not elaborate, I think verbose point that I'm trying to make here is that anything is complicated and sophisticated if you delve deeply enough into it. So just because your in-depth analysis of a situation differs from somebody else's in-depth analysis situation doesn't mean one of those is more valid than the other because it is in line with the current popular paradigm, right? You've got to remember that some specialist, be it allied health or another specialty, might have a certain analytical understanding of their health and well-being and what type of lifestyle it should lead that diametrically opposes your medical opinion if you are a doctor, right? And you have to come to terms with that, the fact that it's simply a different way of analyzing the evidence and the reality of the situation, right? There are different problems people face and they're managed differently, right? I think a classic example is from a sort of endocrinologist perspective, perhaps somebody with some sort of diabetes, optimally would eat no sugar, would manage their insulin perfectly, have a very restricted diet. But from a quality of life perspective, somebody like a psychologist, psychiatrist might say, okay, well, if by following this particular perspective, you restrict your life to the point where it's almost not worth living. If you live for potatoes, carbs, and sweets, right, and if you're a foodie, right, then that's a competing perspective, and it's not any less valid. So basically, long-winded point is respect everybody involved in the multidisciplinary team. It's very, very complicated. Don't undermine other people's perspectives. Don't think that you're king of the hill. You're not.
Absolutely.
Right? Good. Alrighty. So after that long-winded explanation, I think we should touch on one final point, and I think that point should be what do you expect to gain from studying medicine? And I mean, first of all, as generally as a degree, and also specifically from the university from which you're applying, right? So do you want to take the university point first, Mitch?
Yeah, I suppose so. This can be either a minor sort of follow-up question, or it can form the basis of this entire motivation station. Why med at this university? I think I would read the question carefully, just in case it's a why med, comma, and then why med at this university. And make sure that your approach, takes two prongs. But really, you just need to show that you have a nuanced understanding of the institution that you're interviewing at. So, for instance, if you're applying to the University of Queensland, ensure that you have done your research. You know the university, you know the course structure, if you're able to, you've spoken to a couple of current students who are there, so you understand what the culture of the university is. And then, try and take another, step forward again and try and think, well, what in particular do I really like about this university? And don't feel like you have to show them that you've read the university prospectus. Everyone's read the university prospectus. It goes without saying. However, not everyone has a nuanced understanding of particular aspects of the university that aren't always, touted on their university prospectuses, but would really give you the best opportunity to learn medicine in the way that you really want to learn it. If you take that approach, then I think you'll find that it lends itself well to you. You're able to come across more genuine and more passionate, and ultimately, you'll rank higher on their sort of, their feeling of how motivated you are towards medicine at their particular school.
Absolutely. And to wrap up with our final point, we wanted to talk about how medicine will change you. So this is very, very similar to why med. You've really got to think about the sort of skill sets that you're looking to extract from this degree, right? And it goes without saying that, mentioning things like, improving my academic understanding of medicine is very, very banal. It's very obvious. Yeah, like Dodoy, of course you're going to improve your understanding of medicine by studying a medicine degree. What they're actually looking for you to say is which skill sets do you think are important to practice med that you're looking to extract from this degree. In other words, you might want to learn how to be an empathic communicator because that's very important in patient-centered care. You might think it's critically important to be an effective team member, right, and be effective at conflict resolution, which, by the way, is another one of our upcoming podcast episodes in a MMI station in and of itself. So they're looking for these skill sets that you want to build on that will make you a more effective hospital team worker, not I will learn, the full structure of, again, the liver enzyme CYP450, right? That's not what interests them.
And I think that you can really marry that to the why this particular institution by saying, from, say, for instance, if it's a PBL university, from the PBLs, I think I'll be able to refine my professionalism and, what would it be, your clinical reasoning skills.
Absolutely.
And that sort of thing. And if there's a bioethics element or something like that, as is the case at my university, that kind of thing will help you to become a more ethical doctor. So, this is where you can showcase your understanding in a nuanced way of the university, whilst also, marrying that to what you're hoping to get out of the degree, which is essentially, hopefully, skills that will make you a good doctor.
Yep, absolutely. Couldn't agree more. Alrighty, guys. Thanks for tuning in. That was our motivation station for interviews, MMI and otherwise. Please be on the lookout for our next podcast, which is going to talk about conflict resolution and teamwork. In the meantime, hang in there. Keep practicing. You're hopefully in the home stretch of your interview preparation. And as usual, best of luck from the pre-admission game.
See you later.